Let's discuss the diagnosis according to the 8 principles. Diagnosis according to the 8 principles is relatively new. It was first described as a single model in the early Jing dynasty and around the year CE 1680 by Zheng Zhongling. The differentiation of individual principle is, however, seen in books as old as the Yuan Di, Nijing, and Sanghan Lun. In the 8 principle diagnosis, the patterns are differentiated in relation to 4 opposite pairs. These pairs are yin and yang, hot and cold, interior and exterior, deficient and excess. Each element has specific symptoms and signs that characterize it, and these symptoms and signs are used to differentiate it from its counterpart. If there is heat, for example, there may be symptoms and signs such as thirst, dark urine, and a red face, a rapid pulse, and a red tongue. If there is cold, there will be no particular thirst, and the urine will be clear, the face pale, and the pulse slow, and the tongue pale. The 8 principles are ultimately only 2 principles, the yin and yang, where the other 6 principles are subcategories of refined of these 2 principles. Diagnosis would be incredibly simple, but not very useful if we just differentiate between yin and yang, so it is necessary to further refine and differentiate the symptoms and signs. It also means that the 6 subcategories can be combined in many different ways. This makes situations more complex because you can, for example, combine yin categories such as interior with yang qualities such as heat, and you can then combine this with Zhu or Shi. The image becomes 3-dimensional and more intricate. As described, the pairs can be combined in varying combinations. Furthermore, it is necessary to utilize all 4 differentiations to create a diagnosis. It is enough, for example, in an invasion of wind code to state that it is exterior Qi cold, or if there is blood deficient, to state that there is an interior deficient condition. A diagnosis will frequently consist of multiple simultaneous individual diagnoses. There may also be contradictions within the same category. It's not an either-or differentiation, but can quite easily be both and diagnosis. For example, you can have both interior deficient heat and exterior excess cold at the same time. This could be a person who is kidney yin deficient who has been invaded by exogenous wind cold. Diagnosis according to the 8 principles is the basis of all TCM diagnoses. The difference between this and other diagnostic model is that the 8 principles can be and is used every time we make a diagnosis. All differentiation relies on distinction between the 8 principles. Other diagnostic models are relevant in specific situations and usually involve the 8 principles in their diagnosis. If, for example, when making a diagnosis according to Qi, Shi, and Jinyi, you have a diagnosis of blood deficient, it is implicit with this diagnosis that it is an interior deficient condition according to the 8 principles. The 8 principles may appear to be very simplistic, but because these principles are involved in all diagnostic scenarios and because the individual components of the situation are differentiated separately, there is no situation too complex to be analyzed using the 8 principles. On the contrary, when something appears to be complex and confusing, you can always take a step back and assess the entire situation from 8 principles perspective. There are often situations where there are many different symptoms and signs, and it is difficult to gauge which organ are involved and whether it is Qi or blood that has stagnated or where there is phlegm and so on. These situations, you can always ask yourself, what is the overall impression? Is it an interior or exterior condition? Is it deficient or excess, hot or cold, and then proceed again. The eight principles form the foundation of all treatment strategies and acupuncture point selections. The eight principles are also a way of clarifying a diagnosis. For example, if a patient cough, we know that it is a lung imbalance. Because they cough, we also know that there is a rebellious chi. To treat the cough, though, it is important to know whether the imbalance is the result of interiorly generated or exogenous evil chi, whether it is a deficient or excess condition, and whether there is heat or cold. All of these things will help to determine which acupuncture points or herbs are used and whether the acupuncture points should be tonified or drained. Thank you for your attention.